we've done lots of career development events. We do several events with our Healthcare Management Association. So because of COVID, we kind of put our brains together and thought, how can we still be providing some of these things for our students, but yet in a virtual method? So we've got a whole, you've probably seen, one or two or 7 or 8 emails from me about events that are scheduled all week. So we've got mock interviews. I hope you've gotten a chance to sign up for those. We've got other coffee chats and sessions throughout the week to kind of go into a little bit deeper dive on career options. We've got industry professionals. We've got 2 alumni panels set up. One is tomorrow and the other is Friday. So you should have gotten an email and an invite for the one tomorrow. So keep an eye out for social media. We've got lots going on there as well. And so for today's event, we thought, actually, and it was Dr. Jim Walton, who is on the film right here. He said, how can we kind of give some tangible information to our students, like a visualize your career in healthcare sessions? So that's really what prompted this event today. So we're hoping that with this and others, you all leave with an action plan, a to-do list, something that you leave here saying, I'm going to do this to help prepare myself. I'm going to meet with this person, job shadow, maybe read a book. Really something that it's not just another meeting to attend or another class to attend. We're really wanting these sessions to be working sessions where you leave with some experiences or skills or recommendations for yourself to help prepare yourself for the next level. And so today on our panel, we've got Dr. Jim Walton, and I'll let them, we're actually going to get into a little more about their history and their experience, but we've got Dr. Jim Walton, we've got Dan Carnuta, Professor Carnuta, who is our director of the PPHM program. And then we've got Dr. Keith Thurgood, who's the program director for our Master in Healthcare Leadership and Management program. So we're going to dig into a little bit on, what brought them to healthcare, where did they go to college, what was their first job out of college, and then also getting some real world advice from them as far as what to expect as an entry-level position. What are some of the fields that you can get into? And so we have a chat box here on the right. We've also gathered some questions from students. So really this is going to be, questions that students have come up with that they feel are necessary to help prepare themselves. So please put additional statements or opinions, questions in the chat, and then we're going to try to keep a lookout for that as well. So let's see. So just to get started here, I think we'll start off with Dr. Walton. If you can maybe just give us a few, minutes of your time to talk about why did you want to get into healthcare? When did you make that decision? And then what were some of the first steps that you took in terms of your education and your start of your career?
Thank you. It's good to be with you guys. It's always a pleasure to visit with students as they kind of pursue their careers, and I'll just get started. So I grew up in a healthcare family because my dad was a family physician in East Dallas, and I followed him around when I was a young kid and worked in his office and things like that. So I was naturally bent toward the kind of clinical side of medicine because of the conversations I had with my father. I did not know that I would end up in business because I always really had a strong passion for the clinical work. And I know a lot of you guys and gals may have started out thinking you were going to be in clinical medicine, only to find out that your aptitude was maybe more for business. And that's how that's what my journey was like. I went to Skyline High School in Dallas and then ended up at Eastfield College as a community college student for a year and a half because I was a pretty young person getting into college. I was 17 when I went to college, and ultimately ended up from there going to University of North Texas and getting a bachelor's degree in biology. So I was very focused on kind of the clinical or the biological sciences when I was pre-med. I went immediately into medical school, but what was interesting in my work experience during my college career, I worked at a manufacturing plant making paint, Then I worked in a laboratory drawing blood and doing laboratory analysis, learning how to do that. And I, so I had a lot of different kind of clinical experiences. And I would say that that's one of the things that was maybe a little easier for us back in those days, because there wasn't all the regulation that you guys have to go through today. Um, when I was in medical school, I had a job as a waiter. I thought that'd be an interesting thing, that I did work when I was a senior in medical school, because I needed the extra money. I think a lot of students recognize they need a lot of extra money. What's interesting about my career was that when I got into, I became an internal medicine physician. That was my specialization. And when I went into medical practice, I realized that my aptitude was around the business side of our practice. And I was in a medical group that basically all my colleagues, my friends and partners didn't like the business side. That was at the time of HMOs and managed care. And I ended up reading a lot of contracts. And I also got interested in taking care of poor people and building systems to take care of the uninsured back in the 90s. And so that's really got me interested in federal policy, policy making, grant writing, things like that, to try to figure out how to fund some of the projects that I wanted to do for the uninsured and the immigrant population in North Texas. So that's kind of what took me into business. I ultimately got a business degree. I went back to school when I was 49 years old to get a business degree. So I've been where you are recently. I mean, it wasn't very long ago. I was sitting in grad school at the University of Michigan learning business language. And I will tell you that the biological sciences are very different from the business sciences, but they're very much complementary in my view, as I've started to realize that I found that I needed really both to make sense out of our healthcare system. And that was just me. So I've had a really great opportunity to learn about both sides, as well as to be able to teach it now. So that's kind of a little bit about me. I was kind of a natural. I started thinking about being in healthcare when I was a young teenager, following my dad around. And it just has led to an incredible career of taking care of patients, as well as now being the CEO of a healthcare organization in Dallas.
So what's one thing you wish you knew then that you know now?
Well, I wish I'd understood what being a lifelong learner meant. And I think that a lot of times we have a tendency to think that our education is formal, and it stops when we're formally educated. If you get a degree, whether it's a medical degree or an undergrad or a management degree, that somehow things have stopped and somehow you've arrived. And the reality is that quite the opposite, that the training that you get in undergraduate school or graduate school, medical school, are really just training you how to learn. And so if you stop, so the idea is to keep learning and to stay hungry with regards to what do you not know, what do you not understand, and to continue to look at under the rocks and keep challenging yourself with a high degree of humility that you really don't have a full picture. And even at this late stage of my career, I'm going to end my career with more questions than I have answers. And that's got to be okay, because I think that's what makes the greatest leaders. And I think somebody else will say this, is that leadership seems fluffy and non-scientific, but the reality is that being a leader is a requirement to perform well in this. So I'll challenge the group on the call today. Which one of you students are going to be the leader of the students to show your face in this video?
I love it.
Rather than comply and melt into the background, which one of you are going to step up and be a leader rather than sit in the background and not be seen and not be heard? That'd be my opinion.
Thank you. Thank you. So there we go. So I think up next, we'll ask Professor Carnuta if he can join us. And on a similar note, what got you into healthcare? Where did you go to school? And maybe what was your first job out of college? So Professor Carnuta, you are on the floor. Maybe. Do we have him?
Maybe muted. I don't think he's muted. Let me see.
Well, how about in the meantime, we have Dr. Thurgood. Same questions for you. Your history, I think you have a really interesting history. So if you can talk to the students about where you went to school and then how your career into healthcare started.
Well, I'm happy to talk about that, and I could just underscore some of the things that Jim Walton, Dr. Walton talked about, and that is, at the end of the day, one of the things that sets, I think, the healthcare industry apart from other industries is the passion that people have for the work that they do. And as you noted, I'm a little bit unique in how I got to the healthcare world. Unlike Dr. Walton, who kind of grew up with it and it was, he was probably practicing putting in sutures with his dad when he was a young man. And, Dr. Barrett, who has a long pedigree as well. So can I share a screen with you that I thought might help explain this?
Yes, please.
I don't know if this is going to be helpful or not, but as I thought about my own career and how I got to where I am, I'm like, you know what, there's no way to explain any of this. So let me, let's see, how do I do that? I'm going to do screen share and see if I can pull it up and see if this will be interesting to you, or maybe it won't be. I don't know.
We'll not.
Okay, I'm sharing something. Can you see that?
We can, yes.
Okay, so my whole career was based on the fact that when I left BYU as an undergraduate with a degree in political science, which is another story in and of itself, I was commissioned as a second lieutenant in the United States Army. And so the Army has tainted, that's probably a bad word, has influenced the way that I think about leadership and execution and getting things done at the end of the day. And so my leadership journey to the healthcare space started out when I was a lieutenant. And I won't walk you through all these pictures, but you can kind of see where I started and where I ended up. And how I got into the healthcare system one day was I was actually in the Pentagon in Washington, D.C., and I got a call one day from a CEO who had a big system, and they were looking for a CEO to come in to set some strategy, to drive some fundamental changes, and turn the revenue stream around. And it was in healthcare space. And I didn't really know anything about healthcare, quite honestly. I was just a normal consumer. I went to the doctor. My doctor said I needed this, that, and the other thing. I said, okay. I went and got it. I paid my co-payments and premiums. And so I was, like I said, I considered myself an average consumer. But when I was the president of this healthcare company, I learned very quickly about the healthcare space. And as you may know, the healthcare space is complicated. Okay, it's complicated. Not many people know how complicated it really is. And in this role, I had the opportunity to really dig deep into the business side of healthcare. What makes a system work? Why is there consolidation going on? How do you drive out cost? How do you take care of patients? How do you balance quality with cost and access and all those kinds of things? And I just fell in love with it because, one, it's a role that you can impact others in. You can make a fundamental difference literally in somebody's life in the healthcare space, and that's fun. But secondly, I also know that we need great leaders in healthcare. We need great leaders of character to get into the healthcare system. And as Dr. Walton said, don't accept the status quo. Make a difference, make a change. and the healthcare system is ripe for change, and we need great people to do it. And it's also even in the Dallas-Fort Worth area, as you may know, it's a $14 billion industry. There's 300,000 jobs, and if you expand that outside the DFW area, it's a $50 billion enterprise with 500,000 jobs. So we need people. And so I got there in kind of a strange route through the Army and being the CEO and president of other companies and through academia, et cetera. But I tell you this, it is an industry that you can fall in love with and that you can make an absolute difference with. So I'll stop there, and I have another chart I'll show later.
Thank you. So I guess before we move on, what, Dr. Thurgood, what's one thing that, kind of looking back at your past and knowing what you know now, what's one little piece of advice or something new that you would share with the students today?
Well, I should have shared you my other, can I go back to sharing my screen again?
Yes, you're still sharing, you're good.
Oh, I'm still sharing? Okay, well, can you see this chart? This one right here?
Yes.
Okay, here's what most people think success looks like. I go to school, I get my MBA, I graduate, I have a career path, I'm going to go from A to B. So here's my piece of advice for you. Here's what it really looks like. It is not what you think. There are ups and downs, 2 steps forward, 1 step back. There are lateral moves in your career. There are things that you have to go learn and develop and mature as a leader. So my piece of advice for you is, this is what success really looks like at the end of the day. This is what career paths really look like. And so think about that. Be open to being influenced by the environment, by the people that you work with. And because when you do that, you'll be a much better leader at the end of the day. So that's my advice.
Great, thank you.
Okay, you can stop screen sharing me now, for now.
Let's see here.
Let's see if I do that. I think I'm...
There you go, perfect.
Okay, all right.
Thank you. So we do have 2 other faculty on the call. Now they have their own sessions later this week, but we've got Don Taylor and Britt Barrett. Both of them will be hosting sessions, one on Wednesday, one on Thursday. Like I said, you should have gotten lots of emails and invites for those 2 sessions, but those are some bigger, deeper dives into actual careers in healthcare as well. So please keep a lookout for those and attend those sessions too. And we'll probably be hearing from them as we, dig into some of these questions that we've got here from some of the students. But the first question, and this could be either Dr. Walton or Dr. Thurgood, you want to answer this, but looking kind of at the broad field of healthcare and the healthcare industry, are there some specific fields that you would recommend students with these degrees get into or start to explore?
Jim, go ahead.
There's a couple of different, here's how I would frame this up for students today. You have work inside of organizations like hospitals, hospital systems, and you have work that's outside of hospitals and hospital systems. Why do I divide it naturally? Because generally speaking, hospital systems have been capturing the imagination of the workforce for 20, 30, 50 years within the American healthcare system. That is not to say that they're not important. They're extraordinarily important. But what has happened is this emergence of the ambulatory outpatient environment. And so you need to look at both. Okay, number one. So I would segment the industry into those 2 basic segments. Second, then I would tell you that and that would be across the x-axis. Along the y-axis, you would start down and you says, again, everybody's got a gift that they were born with regard to what their natural aptitude and interest is. So I was thinking about it, and I was thinking, look, there's going to be people that are really talented. They really are passionate about communication, about messaging and marketing and communications. That's extraordinarily important for how people learn and take in new messages and respond to them. You have those folks that are analytical, that are more data driven, that are more they're more analytics, they're more reports, they're much more AI. They might be interested in IT or technology or stuff that I call that goes into the boxes, how the boxes work, how things like that. Telehealth is a big, big industry. But I would not make it more important in my mind than marketing and communications, because we all know how important communication is in healthcare. The whole accounting and finance of healthcare is enormously important and very, very big industry. Human resource management is another skill that, down the y-axis. Business operations and management. I was trained as a general manager in my management school. So just being a general manager, knowing a little bit about everything. I'm trained as a general internist. That is, we're generalists. We understand kind of a little bit about everything, but we're not highly specialized in anything. The whole idea of physician or provider networks and relationship management with regards to the different personalities of different specialties or different types of providers, nurse practitioners, PAs, physical therapists, speech therapists, on and on, nurses, on and on and on. So that all that network management, there's strategists, there's people that think naturally about how things are supposed to work together. The notion of how you put things together. There's natural strategists out there. Let's see. And then, of course, there's the legal, people that do deals, mergers and acquisitions, business strategy, things like that. So I would give that. So I would put those down the y-axis and then kind of say, what am I more interested in what happens inside of a hospital system, a consolidated system, or what more happens out in the non-hospital system world? So I'll give you that construct to work with.
Great, thank you. So a follow-up question to that would be, let's say someone really likes one thing but wants to learn about the other, or they want to build a skill set in something else that sounds interesting. What would you recommend that they do now while they're in college?
Well, I'll take a stab at that, and then Dr. Walton can jump in as well. And by the way, I think it's a really good point that Jim brought up, and that is, it's super important for everybody to find their voice, your passion, play to your strengths, because when you do that, you're more productive, you're happier, you're more engaged in the organization, and that bleeds off into how you impact and interface with clients and customers and patients and those kinds of things. So finding your voice and playing to those strengths is really important. And as Dr. Walton mentioned, there are a variety of activities inside of a healthcare system. You might want, we typically think of the clinicians, but you can do all kinds of other stuff. Supply chain. You could be involved in staffing. Maybe you're going to be on the payer side and you're going to find clients, and so you're on the sales side of healthcare or staffing. If you can think of a role, there's probably one in healthcare. And Quincy, I forgot, what's the question? I wanted to get that out. Sorry.
Yeah, I get so involved in what you all are saying that sometimes I forget what the actual question was. But so I'm wondering kind of the difference. So we have lots of students who say, I love this and I'm really interested in it.
Yeah.
Compared with what I'm maybe my predisposition or what I feel like I'm wired to do. So how do you kind of balance that? And if you know you have a certain personality or you're kind of maybe inclined to be a certain way, but you want to learn about this other side, what are some things that students can do now to kind of explore the other side of their brain maybe, or skill sets?
I like the idea of using the matrix that Dr. Walton talked about. Just lay it out, the pluses and the minuses. So we're all naturally good at something. Play to your strengths. That's your passion. That's your voice. Go do that. But explore other things, and you could prioritize the effort. I can't tell you how many times I've talked to students and they're totally interested in, say, I'd being a clinician. And then we start to talk about informatics and the emerging technologies and trends in the healthcare industry, like telehealth, as was mentioned. And they're like, oh, I've never thought about that. And so I would say, as I tell my kids and my grandkids frequently, options are good. You can always say no. You can't always say yes. So keep the doors open. Use a matrix. Prioritize what you're passionate about, and then go explore other things and who knows where it'll play out? I don't know, Jim, you got a point of view on that?
Yes, and I think this is the hardest. This is really a difficult thing, and it kind of intersects with economics, personal economics, a family, your family economics or your personal economics, which is I have found over the course of my career that I am intensely curious. Now, I also sometimes that curiosity can bleed into cynicism, but the reality is that I'm very interested in what I don't know. And so as Dr. Thurgood is bringing up, you're going to naturally need to lean into what you're good and strong at. But the humility it takes to say, but I'm weak in this area, and lean into the weakness is also it's counterintuitive at times. It costs money, it costs time from other things. And the reality is, and this going to balance with your, how do I distinguish myself? Well, number one, you click on your video, number one. You actually show your face, you show up, you find your voice, as Dr. Thurgood has said, you show up, you find your voice, and you maintain some degree of humility of saying, I don't know a lot about that, but I'm going to go find out one thing. What you have as a generation that we did not have is sitting in your hand. It's the thing that you use every day for something else other than learning about the things that you don't know much about. And so my thinking is that if you could kind of harness that machine that you have in your hand out of the humility is that I don't really understand a lot about this. That's what that machine is for. And then bring that forward with your voice and say, I want to better understand this. People like Dr. Thurgood and Dr. Barrett, myself, are very interested in engaging those types of issues while you're in school. The gaps in your knowledge, where you're hungry to learn in your area of weakness. That means more to me than a lot of other things as far as all the strengths that you have. We recognize that y'all are very talented people, or you wouldn't be on the call. So let's dig into what you really want to learn that you're not very good at.
And if I could piggyback on that, here's the other thing. So if you're the CEO, you're the hiring manager of a company, of a hospital system, just take a step back and ask yourself, what kind of people, what kind of leaders do I want in my organization? Who would I hire and why would I hire them? And then compare and contrast that to yourself. And very often you'll find out that there's a gap between what the kind of person that you would hire and the kind of person that you are. I can't tell you how many conversations I've had that go like this. I can't find a job. Why can't you find a job? Well, because this and that, and I'm unsure on what I want to do. And I'm like, well, okay, well, that's a problem. So you just told me in the first 30 seconds of this conversation, you're unclear on what you want to do. You're not passionate about anything. You're waffling here on me. You got to convince me, right? And so those are the kinds of people that organizations want. They'll teach you the technical skills and all that kind of stuff. But again, to put a finer point on all this, if you're passionate, you have a desire to be a lifelong learner, you want to make a difference, you present yourself well, all of that weighs heavy in an interview, in my opinion.
I would tell you is that go into the interview having being able to talk about the most recent book you've been reading. Make sure you have one, especially if you're going to come talk to me about a job. But I think people
don't make it where the red fern grows or the boxcar children.
My generation of leaders once, and just by the way, for those of you on the call, even though it seems that the generation doesn't really read deeply, that's not necessarily true. What I continue to see and am amazed by is the depth of talent in the generation, on the people on the call. Because I'm teaching as well at the school, and it's amazing how some of your colleagues are going deep every single day, digging and studying and reading outside their core curriculum to understand the industry, and that's who you're competing with. So when we give you this advice, it is not to say, it's not a condemnation, not of the generation, quite the opposite. It's to say your generation is digging, and y'all are bringing a lot of game. If you're not one of those people digging deep into your area of weakness, you're going to be behind the ball when you're competing for work. So take that to heart, because those are the secrets to success of getting an advantage. Like in an interview, you can throw into the interview, hey, I was reading about this recently, and I have this, it's been really kind of tumbling around in my mind about what this really means. Someone like me will sit back and go, wow, that's incredible. So think about that. That's a little tip. That's free. So it's a free tip.
So I kind of on a related note, and it's sort of related to a question that was asked by a student is, how does a student find out what their passion is if they are unsure? Let's say they've thought their whole life they were going to do, even, for example, they wanted to be a doctor, and they realize they don't want to be a doctor necessarily, but they want to get into healthcare and the rest of what it is that is so broad. But do you recommend, are there books that you would recommend students read? Are there articles they should go to or websites? What are some tangible steps that students can take now to kind of figure out what it is, where is their passion, or what are the possibilities?
I've had a lot of that. By the way, I think it's HMA at the school developed that mentoring program. Is that correct? Is that the right organization? I'm always intrigued by my students out of my classes who will call me and say, can I come and have it? Will you give me an hour of your time? And then guess what? Maybe after that hour, they said, could we meet again? I had one student take me to lunch several times. Yeah, but what he was trying to accomplish was to resolve some questions that were in his head. So I think that you should feel permitted, the students on the call, to reach out to your professors and to say, I'm working through this topic in my head. I'm a little bit not clear. And I think what you'll find is that light mentoring all the way to heavy weekly or monthly mentoring is a good solution, because it's another voice than your parent. And that's vitally important. One of the blessings of my life has been, I raised 4 boys, has been the men that they found in the workplace that mentored them after I was done, because I couldn't do any more for them. And so I think that's what we're here for as professors a lot of times. It's just to help you with some of those questions. That'd be the first start. And then the books, the articles or the books that you're referencing, Quincy, would be customized for that student where they are in their journey. I'll let Dr. Thurgood answer.
Yeah. Okay. In the spirit of, I'm a visual person, I'm going to share my screen again. So I'm just sitting here listening to the conversation. And let's see, I want to do that. I want to go to my whiteboard here. So here's something that I learned early on that helped me. And so bear with me for as I draw something here.
I am impressed. This is good.
So here's the thing. When I think about leadership and getting leadership right, there's certain things that you have to get right. The first one is you have to be a self-aware person. And we've been alluding to that in this conversation. That implies that in order for you to be an effective leader, your life must be first and foremost centered on your character, your personal character. And at the center of that idea is this idea that I'm personally trustworthy and I'm a person of integrity. And more on that later if we get to it. But here's what I want you to think about. So most people, I'm going to draw these are concentric circles. Most people think about their careers and their life from the outside in, when you should be thinking about it from the inside out. And the way you think about this, I'll give you 2 pieces of advice here. One is, think about what it is that you want to be. Whatever that is. if you're passionate about this, that, and the other thing, figure that out. And you'll know when you find that, when you wake up every single morning and you say, I love what I'm doing. I love the direction my life is going. So spend a lot of time thinking on what it is that you really want to be, to become. Then once you figure that out, you start to do things that deliver on that be. You start to do things that deliver on that. And then the natural consequence of doing certain things is you get certain things or you have certain things, right? So be, do, have is a way to frame this up in your head. And I'll tell you a simple way to think about it. If you decide that you want to be a millionaire, you will do things that drive you towards that. And the natural consequence of doing all of those things is you'll be a millionaire. If you want to be a teacher or a professor, then you'll do things that take you towards that end state. And the natural result is you'll be a professor at the end of the day. So that's number one. Now here's number two. And this is something that I know that Don could talk about as well. In the Army, one of the things we do really well is we grow and develop leaders. We grow and develop leaders. There's no other institution that does it as well as the military and the Army in particular. And one of the things that we do is our careers are based on three big components. One, the formal learning that I get. So I go to school, I get a degree, I do all those kinds of things. Number two is the things that I learn on my own. And Dr. Walton alluded to some of those. It's the books, it's the articles, it's your sense of curiosity. And in those, when you do read those kinds of things, you find nuggets that are impactful to you. The third thing, though, is your experiences, your life experiences that impact your worldview, your ideas about diversity and inclusion, leadership, business. It doesn't matter. Your experiences will help shape your thinking. And one way for you, so here's the advice. One way for you to do that is to think seriously your own personal leadership style, your own personal leadership philosophy. So as a CEO, one of the things that I used to ask people, my senior leaders that I would hire, is I would ask them to explain to me what they thought about leadership and their leadership philosophy. Why? Because if there's one thing in any organization that makes a difference, it's the quality of the leaders that you have. I don't care if it's a big organization or a small organization. You get the right leaders in place and you can move the world. If you have the wrong leaders, it's impossible to sustain excellence. And one way for you to think about that is this concentric circles that I just drew, but also think about how you define leadership in your own life and how you can bring that leadership to bear to make a difference. Because we just don't need leaders that think about it. We need leaders that take action. So those would be my two pieces of follow-on advice.
Keith, Dr. Thurgood, I think one of the things that I've discovered, I don't know if this is true for you, but leadership is a little bit like exercise. That is, if I want to be in fairly decent shape or strength, if I want to have strength or I can run, I have to exercise and it's painful. My experience of being a leader is that it's like a daily or weekly discipline that I've got to work at. It's not I woke up and decided I would be a leader or I would have good leadership principles. I have to pursue it every day of my life or every week of my life. And I have to actually put myself out there and take some risks of failure to actually be a leader. And so I think sometimes when we use the term leadership, we undersell how hard it is, right? Which is, when we talk about the Army developing great leaders, that means it's painful. I can't even imagine being in the Army and them making me a leader in the Army. That just sounds terribly difficult, right? And then how do you do it when you're not in the Army, when you don't have someone telling you what to do, right? I'd like for you to kind of riff on that a little bit, because I bet you've learned a lot over your years about that.
Well, here's what I would say, a couple of points that you just brought out, and I think this is good counsel for the students as well. One is, It's called leadership development for a reason, right? I don't know of a single book, flowchart, matrix, seminar that I can say, go read this and you're a great leader. No, it's called leadership development for a reason. And in the United States Army, if you want to be a mid-level manager, a mid-level leader, guess what? Which we call lieutenant colonels. So this is somebody that's been in the Army for about 20 years. It takes 20 years for us to develop a commander like that. 20, right? Why? Because when you're in these high-risk positions, which the military is obviously, but you can make the same argument for healthcare. You need people that know what they're doing, and so there's a process that you go through, and it never ends. We're on a journey here. We're always getting better. We're always learning. We always reserve the right to get smarter. The second thing that I think that Jim mentioned is important is failure is a tutor, not a tragedy. So very often we look at people that don't do exactly what we thought they were going to do, and we classify them, quote, as a failure. So go back to that chart that I said about what success really looks like. I'm telling you, the best leaders I know have the mindset of continuous development and learning. These are leaders that are taking the appropriate risk. They understand that learning is the way you drive organizations and how you get better as a leader. So failure is not a tragedy. It is a tutor, and we have to look at it like that. When you find leaders who are crucifying the folks that are making mistakes every single time, it's like, that's a red flag. It's time for you to move on. Now, if you're the person that makes the same mistake 15 times in a row after I've coached and teach and mentored, then that's another conversation. But I don't know, Jim, back to you.
Can I add to that, Jim?
Sure, Brett.
I think that's very insightful. I think leaders hang where leaders hang. And I think, we're talking about the evolution. I commend the students that are on this call. You're of a very small percentage of individuals that have an interest. And so from my perspective, you're taking the first steps, you're separating yourself. The majority of the world will sit on the sidelines or allow others to take the passion. And so by virtue of, and I'm looking at some of the names of the students on here that I know, and I know they're great leaders. I should call them out and embarrass them, but I won't. You're the real deal, folks. You're the real deal. And to get this kind of mentoring from talents like Dr. Walton, Dr. Thurgood, Dr. Taylor, Professor Carnuta, it's invaluable. Most people don't take advantage of that. So if you're sitting there going, I'm not quite sure, you've already moved in the right direction. So kudos to you.
I think
words of encouragement on your 20-year journey.
I think the comments that I would say is, that was already listed. Don made this comment. I'm just going to elevate it as a CEO, president CEO of a couple of companies. I will tell you, for all the students, that I am still following. I'm not always leading. Now, think about that for just a second. I have to return often when I am doing my weekend, let's say, or a weekend day, and I have to go back to my why. Like, why do I want to teach? Why do I want to be in the role that I'm in the organization that I'm leading? And part of it is because I serve the board of directors. I follow the lead of my board. The chairman of my board and I talk every Monday for 15 to 30 minutes, and I listen for what his direction is to me as this. Even though I would call us a very senior leader in the healthcare in Dallas-Fort Worth. So you never stop following, but even I think where Dr. Thurgood was going was you follow your why. You follow some intrinsic value system that you've you've gained from other leaders of what's made them successful. And so I do think that making sure you're a lifelong learner and that you know your why, and your kind of your North Star, what are you pointing to in your career? Now, that Quincy's going to should practical. We should make that practical, right? We should okay, when you show up for the interview, what does that mean, right? When you're talking across the table to the hiring manager, what does that mean? And I'm telling you, you go root yourself in your why. Why have you come for this job? What difference will you make to this organization? And talk openly about your hunger and your passion and your curiosity and your desire to make a difference and serve. You had me at hello. Okay, you'll distinguish yourself from the others who think they want to talk about they want me to talk about the technical things. And it really, as Dr. Thurgood was saying, I can teach you the technical stuff. What I want is heart and courage in that space. So that might be a little bit clue where I would go.
Dr. Thurgood, on that same kind of note, what advice would you have for maybe just at the time of the interview? How can a student best prepare themselves for an interview?
One is, in addition to some of the outward things, so make sure you're dressed appropriately and you're dressing however the company dresses, etc. So if you're going to go interview at Google, you're probably not going to wear a tie. If you're going to Methodist Healthcare, you might. So understand that first as just kind of a basic thing, because a normal interviewer, and you've probably heard varying statistics about this, but a normal interviewer in the first minute or so has already come to a conclusion about you, either for good or ill. And so you want to make a great first impression. That would be one. And the way you do that is the way you present yourself and the way you look. Number two is find out a little bit about the company that you're talking to, right? So if there's M&A activity going on, leadership changes, understanding what they're struggling with, because a company wants a return on their investment with you, and they're willing to invest in you, but they want an ROI at some point. So that I wasn't going to do this, but can I share one more thing?
Of course.
Okay. So I just had a bunch of stuff that I've been thinking about. Okay. Am I sharing yet? No. Share content. Let me come back to, let's see, where was I here? Right here, no, that's not it. Right here. Okay, can you see that chart now?
Not yet.
No. Okay. Well, let me see. Okay, hide share options. I don't know what that means. Share content. Okay, let me click on it. Can you see that now?
Yes.
Okay, so here's my other piece of advice related to this entire discussion. When you go to an interview, they're betting on you becoming somebody that can provide value to the organization. They're not just going to hire you because you look handsome like Dr. Barrett. They're hiring you because you're going to add value. And they know that they're going to have to do a little bit of an investment up front. So here's a little chart that I put together. It says, look, when you go to the interview, you're going to sign on and you're going to spend 6-8 months, maybe a year going through their system while they're investing in you. But at some point, they're going to want a return on that investment. And that's down the road somewhere. So to the extent in the interview that you can begin to articulate the value that you can bring, and you can quickly get a return on their investment, the more likely you will to be hired. Number three, after you figure that out, right, you have to be able to speak and articulate and tell a story. People love stories. So stories are easy to tell when you're passionate about something. It just flows naturally from you. So if you can tell a story about why you think you can make a difference and cite some behavioral examples around that, I'm telling you, you're going to win. But if you can't do that, you're going to be just another person that showed up for an interview. And you're going to go back to your dorm or house or wherever, and you're going to feel bad about the interview. And you probably should feel bad about the interview, because look, here's what I remind all my students. I know this might be disappointing to many of you. There's no such thing as free shipping in Amazon. Sorry. There's no such thing. There's no free healthcare. There's no free shipping in Amazon. There's no company that's going to hire you just because they feel sorry for you. They're hiring you because they know that you will make a difference. And to me, that kind of encapsulates everything that we've been talking about. So those are the three practical things that I would suggest.
Thank you. Well, kind of on that same note, kind of a reality check. What would be, and we've kind of just throughout talked about recommendations and advice, but as far as kind of thinking about, and as soon as the students graduate from these programs, what can they expect in terms of entering the workforce as either an undergraduate, a graduate? We have some who are dual degrees on this call who are MS MBA. So there's a scale of students and demographics, but what can they expect entering the field?
I want to make a comment about MBAs, MHAs, master's degrees on top of your undergraduate degree, and speed with which you obtain them. I was a student who probably when I graduated from medical school, I was the youngest student in the state of Texas to have a medical degree. That sounds really cool, but it was a detriment. Okay, so let me just caution those of you who you should get through school as quickly as you can, because it reduces your cost, right? That's the reason why you should do it, because you're not going to learn as rapidly. You're not going to assimilate all the knowledge that you need by going faster. You're going to actually probably need to take some time to learn the stuff that you were supposed to learn when you were going so fast. That being said, graduate degrees are extraordinarily important because it says to me that you went deeper. You wanted to understand what you couldn't obtain in undergraduate school, and so you spent some more time in learning particular areas that you felt like you wanted to shore up before you got into the workplace. Number one. Number two is that if you want to work in healthcare, then you probably are more service or servant oriented. So your first job could be in service. I don't care what it is. You can serve food and then in your healthcare interview, you can say, well, this is what I've learned by being a waiter. Okay, or working as a bartender or working at Starbucks. It's easier to get a job when you have a job. Okay, so don't wait for the perfect job. I talked to a young man just the other day. I said he wants to go to medical school, and he had the opportunity to get a scribe job, but the hours are bad, and they pay lousy, and he'd have to stay at home living with mom and dad. I said, take the job, for God's sake, because when you get that job, you're basically fixing to springboard into all kinds of understanding of what's in that organization for your job opportunities. So I think there is a little bit of ding on the culture of your generation to wait for the perfect job. Don't wait for the perfect job, because there is none. They don't exist. Take the job that you can talk to me about as your next interview, is what you learned on how to be a servant and a follower and a leader and continue your learning journey after you graduate. So you got your degree, it taught you how to learn more information, and then you continue to learn while you're in your next job.
I think that's perfect. And by the way, remember this, when you come into a new organization, you may have gotten a dual degree and been the valedictorian and had a 4.0 grade point average and all that kind of stuff. All that's great. But when you think about what happens when you come into an organization, you have to start to build your own credibility within the team that you're in and in the organization. And the way you do that is by delivering results. It's by collaborating at a different level. So the other thing I would add to what Dr. Walton said is take advantage of all of these little extracurricular activities or assignments that come up, right? Somebody that needs to be the head of the United Way thing, somebody that's doing a blood drive, somebody that's leading diversity and inclusion. Why? Because it helps you. It helps you on your learning path. And oh, by the way, you get to know people and you can help them move their agenda forward and they can help you move your agenda forward. So that would be another practical advice when you get into an organization.
Great, thank you. Well, we have just a few minutes left. Are there any other questions that students want to either unmute yourselves and ask or stick in the chat? And then we'll just end with, a final piece of advice from our 2 faculty members here. Anybody?
I have a question.
Yes.
It would be probably, what is the experience that any one of you have had that you valued the most?
Good question.
I'll start and Dr. Walton can jump in. The experience that impacted me the absolute most was when I was in Iraq, sharing risk, getting blown up, high intensity. And most important, it was serving those soldiers in a combat zone, to piggyback on what Dr. Walton said. I think the best leaders understand that they're not only are they self-aware and followers in many ways, but their job is to serve those in their organization. So to me, that was one of the great experiences of my life.
Yeah.
Jim?
I think that I'll riff a little bit off of that. Would be my memory of. I mean, it's a long historic arc, right? And so if you think about what is the most memorable, I'll be frank with you, were the points of failure, where maybe a patient died that I was caring for, or I was in an international mission where something went really sideways and not a good outcome, that things didn't work out really well for people. Similar to the war metaphor, the war analogy that Dr. Thurgood bringing up, a lot of memorable things over the arc of a career for me have been around what seemingly was extraordinary failure, and they were poignant and difficult. It was a very difficult time and challenge, and to work through all of that resulted in a stronger conviction about my why, and kind of picking yourself off the dust. So it's a little, the axiom that I use a lot now is, I'm not sure if I'm going to be successful in my day job, but I'm going to continue to show up. And I probably will outlast you. There's a small because I'm going to show up a whole lot more than you're going to show up.
Love it. Looks like someone has their hand up here. Do you want to unmute yourself and ask a question?
Yeah, thank you, Quincy. I actually have a question for everyone. If you could answer me, how is the career in relation to project management in a combination with healthcare? This is my question, because there are many roles like in medical device and pharmaceutical industry, where there is a combination of healthcare project management or associate as a few roles. I've been looking forward to that on LinkedIn, but I'm really not sure how is that kind of career for a graduate student here.
I had a couple. I answered the question Quincy had sent me was, and there's all kinds of initial entry-level roles, and one of those roles would be program manager, project coordinator, program coordinator, that are what I would call entry level. That would be I think we naturally as leaders, if we have a need, we scan resumes for evidence of that type of experience, and then we interview for it. So I would look at, a dozen resumes to look for 3 or 4 people to bring in for an interview. If I had a project or a program that I wanted coordination, if that's helping you. And though if you distinguish yourself in some experience for example, as Dr. Thurgood was bringing up, like if you were in a club in undergraduate or grad school and you initiated or helped manage a project or program, that would say to me, as the person reviewing your resume, that could be a person that could be a great candidate for that. Short of that, when we look internally, let's say you're already in the organization, maybe you're an analyst, and I say, golly, you really look like organized logistics. Keith Thurgood's area now, but in logistics and understanding how to put things together and how to move things from point A to point B to point C in a systematic way, we can see that in people who we hired as an analyst, but really they're great project or program coordinators. So that's kind of my short answer to there.
Thank you, James. Thank you so much.
Okay, and there's one question in the chat, and this will probably be our final question that we have time for today, but it is, which is preferred, doing our master's immediately after undergrad or getting experience first?
I would say the answer is it depends. Okay, so if you're passionate about learning and you think that's your sweet spot, rock on. On the other hand, right, I think that the students that I think the best graduate students, this is my observation, others may have something different. I think our best graduate students, though, are those that they got their undergraduate degree, they went and got some experience in the healthcare space, and then they come back. Why? Because when you come back with that experience, you have a much different point of view about reality and what's going on. And you can contribute to the class and to your fellow students. And your thinking is broader, your worldview is different, you're more mature, etc. Now, like I said, it depends. I think either approach is fine, but students that have gone out and come back tend to take this, they tend to do a little bit better and are deeper critical thinkers. That's my advice.
I would agree, Dr. Thurgood, that the best students are those who can hang, what I call it, once you've been in the workplace for a while, you can hang ideas on what you already know inside your head. Your brain has already created new files after you've left. Now you're in the workplace. And when I'm teaching or somebody else is teaching, you're now attaching that idea to stuff that you've already experienced. And so more experience, the better, helps you hold on to ideas that are oftentimes new. That being said, in a marketplace, now we're fortunate in Dallas-Fort Worth because we don't have the kind of recession and unemployment that other marketplaces have had. So depending on where you are in the country, you couldn't say this to maybe your cousin up in Cleveland, let's say, or some other place, because the recession and unemployment rate being really, really high, there's not a lot of jobs, meaningful jobs. And so a lot of people might have a natural tendency to stay in school because they don't really have to get into the workplace. They have the opportunity to stay in school and continue to learn. So if you can't get a job, sometimes that's really hard to take time off. So maybe staying in school is a better option. But I think if you have the choice, getting some experience will definitely make you a better student and make your investment in your education more valuable because you're going to pull and extract more out of the experience than you will otherwise, just because of by virtue of having more framework in your head to attach it all to.
Great, thank you. Well, any last words of advice or something we can send these students off into the world with a piece of a recommendation or a word of wisdom, perhaps?
To me, this conversation is centered around a couple of key themes, one of which is leadership. So one action that you can take leaving the seminar is to think about your leadership philosophy. What makes you different? And start to write that down as your personal constitution. Jim?
I've been just really, really impressed with the caliber of students at UTD and the diversity. I will tell you, your history, your culture is extraordinarily important for the world, for North Texas if you stay here, but for the world in general. Your generation is just extraordinarily gifted, extraordinarily blessed, and has the opportunity to really make significant changes. What I would advise is know your why. Why? Why do you show up every day? Why are you going to work longer than somebody else? Why are you going to continue to show up when things go really south and you have when it goes really bad for you? You got to know your why. That's your root. That's your North Star. But understand that you've been given extraordinary gifts and blessings. Knowing your why will make the most powerful contribution.
Great. All right. Well, thank you all so much for joining us. Thank you, Dr. Walton and Dr. Thurgood, for just offering your advice and your feedback, your recommendations from your own careers. To all of you students who've been a part of this and for this upcoming week, we just thank you for investing in your own time as well. Also, a big shout out to Ray Woodcock, who's on the call. She's on our program side of things just for helping facilitate so many of these details. Also, Mehul Patel, who's the VP of the HMA. He really was instrumental in helping us orchestrate this upcoming week. We've also partnered with the CMC, and so I put a note in the chat too, but if you need help with resumes, interview skills, they have several workshops that are pre-recorded you can attend. They can also set up one-on-one personal appointments if you have questions or need help, and so check out that chat there. And then we'll just keep sending out emails throughout the week on the different coffee chats, different things that are coming up, and we just encourage you to attend. Dr. Dawn Taylor is Wednesday, and then Dr. Britt Barrett is Thursday. So check those out and sign up for those. And we will see you again soon.
Hey, wait. Also,
Yes.
Here's one other thing.
What?
Join HMA if you're not already there, and join ACHE. It will help you.
Yes.
Put it in
Thank
the
you very
chat.
much. That was very valuable. Thank you.
Oh,